So thank you, Sunny, for inviting me today. Had a little wry smile when that bit about the critical friend request came up, because I think half of them were probably from me. As Sunny said, I'm the portfolio manager for mental health, learning disability and autism for NHS England's Midlands Region Workforce Training and Education Directorate. It used to be an awful lot easier to say HEE. For those of you who are not in a mental health, learning disability and autism setting, I will apologise now that what I'm about to say about some of the stuff we've done is heavily skewed to mental health, learning disability and autism. However, there is another me who covers cancer and diagnostics, and so again I can probably connect you up with those if you sit in that arena. Don't want to steal, because I know Adrian's going to talk a little bit about the long-term workforce plan, but these are the kind of three main elements, which is about training people, retaining people and reforming the way that we train people. And if you look at the long-term workforce plan, you can kind of see where some of those bits come in, but I'll pick up a little bit more in a moment. So just kind of wanted to talk through what we've been doing in Midlands as from a mental health, learning disability and autism perspective, but also some of the things that we've done through the PPN. So for talking therapies for anxiety and depression, we've got the psychotherapeutic counselling training, and we've got people in the Midlands who are progressing through that. That's a 3-year programme that supports a different type of workforce in talking therapies. We continue to grow the talking therapies workforce, and those of you who do work in talking therapies will be aware of the annual conversations that we have about our training needs. And we've also procured additional education capacity for the Midlands for talking therapies. And then moving on to psychological therapies for people with severe mental health problems. This is a huge training portfolio, far too many to list on here. But there's 22 education programmes across those. And in 22-23, that was 859 training places that were taken up, which is a significant chunk. But we know that there's still more to do in that arena, and there's more to do to support people to get through the training, and there's more to do to develop more education provision for the Midlands, that's in the Midlands. Clinical psychology and child and adolescent psychotherapy, this was a commitment in the long-term plan and the mental health implementation plan to continue to expand those training courses. We've done it, we've re-procured, and we have more people going through. I think one of the challenges we have for clinical psychology particularly is about that movement into employment within the healthcare sector once they've trained. And mental health wellbeing practitioners. So we've done lots of great work with mental health wellbeing practitioners in the Midlands. I'm glad that there's a few of you here today as well to talk. But we've extended that offer out to drug and alcohol teams, to perinatal teams. We're talking about prison healthcare, and we're really keen to explore where else we can utilise mental health wellbeing practitioners in healthcare settings. Children and young people's mental health. Most of the work around here is to do with the establishment of mental health support teams, so absolutely crucial in this post-pandemic world around supporting young people's mental health and giving them early access through schools. So we had 104 starters in 22-23 and even more for this year, and I'm glad that what we're now seeing is further expansion in future years of mental health support teams and those education mental health practitioners, and also children's wellbeing practitioners who can work across a much broader children's setting. Some of the work that we've done really closely led by the PPN is around the paid work experience for aspiring clinical psychologists. We continue to support placements every year. It's probably not as many as we'd like to, so we'd like to continue to expand that. Mentoring opportunities for people from a Black, Asian, minority ethnic background, and clinical neuropsychology. This is the bit where my product knowledge fails me, because I know it's the course, I don't have a professional background, so I don't really know what it does, but I know that we're expanding the training places. And this is why Sunny gets, you know, all of those critical friend requests. And we did a webinar last year that showcased the wider role of psychological professions as part of physical healthcare pathways. So in the future, so some of you will be aware, in fact I've been having some little kind of networking conversations. So Health Education England formally ceased to be on the 31st of March, and we transitioned into NHS England, and we're now creating a new NHS England. So really pleased that Psychological Professions Network is part of that operating model. We've got some tweaks that we've got to work out about how it sits. I think the preference is that it kind of sits as part of a clinical leadership structure, which I think, again, perhaps moves it away from sitting too much under the mental health space. But it does mean our transition is an awful lot less staff within NHS England, so we've really got to think about how we do things differently without losing the momentum that we've got around psychological professions and that development. We know that integrated care boards are continuing to develop. Their maturity is different, so how do we best link in those and make sure that the psychological professions voice is high on that agenda? And I know Sunny has that in her mind too. And you know, increasing the visibility of the psychological professions and their contribution across all of the pathways. And again, that continued focus in terms of some of the stuff we've done around equality, diversity and inclusion, about making sure that psychological professions workforce is representative and is diverse, and offers our patients that what they need in terms of seeing somebody who looks like them, is like them. I've mentioned this again, you know, retention of the workforce that we train. I think some of what I would say the well-being practitioner type roles, we need to establish more career pathways for them so that they, you know, they continue to grow and stay working in healthcare. But also, again, you know, clinical psychology and those roles about making sure and supporting those people to enter the healthcare workforce and stay and develop their careers. Because otherwise, all of the stuff that's in the long-term workforce plan will be busy training people and supporting people, but the workforce won't grow. And I'm sure Adrian probably has got this, but this is just a little slide that actually just pulls out some of the headlines in relation to psychological professions from the long-term workforce plan. Thank you.
Thank you. I know that we've got a plenary session towards the end, but Helen, I know that you've also got a dash back to Stevenson Street as well.
And dash back. I'm going to get the steps in today.
You will get the steps in. Just don't jinx any more on the fire alarm. But have anybody got any immediate reflections or observations or comments that they would like to give? Judith, going to see your hands to Judith there.
Hi, Judith.
It was just about mental health wellbeing practitioners, because we've managed to procure some dementia services and they've been an absolute overwhelming success.
Yay.
Brilliant. Is that something that's been done nationally, or is there other areas that happen?
Actually, Adrian might be better answering that question, because you've probably got a broader perspective. I mean, I think we've worked really hard in the Midlands on mental health wellbeing practitioners.
Yes.
Yeah, I mean, I'm not aware of any other pilots of that sort. I'd be really interested to hear more about it. You know, there's obviously a balance between wanting the fantastic skills of mental health and wellbeing practitioners to spread across the universe, but also being aware of the very specific education pathway that MHWPs are on and the specific skills they learn. So, but let's have a chat.
So, I mean, some of this I think sits through part of the long-term workforce plan talks about enacting the people promise. So I think what we have to do is we have to create that whole suite of things that makes healthcare, and I'm going to say NHS here because of course the long-term workforce plan is heavily skewed towards the NHS, but I think we have to make ourselves as good employers, and we have to make people want to come and work for us. They train with us, so you know what are the barriers then to them coming into employment? Some of it we might not be able to do anything about, but things like flexible working, portfolio careers and all of those kinds of things. So there is lots of work going on around in the people promise.
Can I just chip in? It'll come in later today, I think, but we're going to talk a bit about the CAPS roles. So the clinical kind of associate practitioners or psychologists, and they're, as my understanding of it is, they're very much kind of homegrown. So the idea being that they come up through their local university, they're people who potentially are really interested in therapy, not necessarily doing a thesis and getting a doctorate, but and their hope is that they will go on to their local kind of university, do the master's level PAPS course, and then go into a local employer. So actually the therapists there are representing their local community, they're kind of representative and very much homegrown. And so yeah.
It's about anchor organisations, isn't it? Yeah.
I think absolutely. I think I was going to say the same thing. It's about actually maximising our positions as anchor organisations in the system. And I think there's also something about making sure that you have representatives who are feeding into conversations at a system level. So if I reflect, we're here in Birmingham and Solihull, we have an ICS. We have an education collaborative which is looking at exactly what we're talking about. It's not just a pipeline of training, it's actually the retention and progression. It's how we support people to have careers. And one of the things that we've been asked in Birmingham and Solihull, and I know colleagues in Coventry and Warwickshire have been asked the same as well, is to develop a form of a faculty or a council for psychological professions, so that is actually understood professionally, so that we can also guide that. So my plea to you all, in whatever system that you work with, John and Leicester, it must be, they're doing something similar as well, is exactly that. Actually, the doors are open. Walk into them with ideas about how we can absolutely support recruitment, retention and progression for psychological professions. Marilyn? Oh, 5 minutes, what you want to have a question, Marilyn? Any more for Helen?
Just one thing to add on the retention thing, if that's all right. I think it's really important we're evidence-based in our approaches to retention. There are lots of sort of narratives and stories circulating about, you know, the mass departures of psychological professions from the service, and of course we are feeling enormous pressures. But I think we've just got to be careful to look at the evidence. Who is leaving? What's the rates of retention compared to other parts of our workforce in the NHS? And some of that data actually doesn't really support the narrative that there's this mass sort of departure problem. Of course, we're training far more people, so we are seeing more people leave the NHS because we've got a bigger pool from which those people are leaving. But the rates of departure seem to be fairly steady.
I feel like we could be entering into a conversation about electronic staff records as well there.
Yeah.
About tracking and understanding.
So it is already, we believe, in the gift of employers to tie people in on a reasonable basis to employment post-training. Obviously that involves in you employing the person while they're a trainee, so it won't apply to most clinical psychologists, for example, because they're employed by a host trust and do a rotation. But for some of the other occupations, we think it's already a legal possibility for employers. So in a way, it sort of doesn't depend on the national team making strides forward on this, but watch this space because there may be some further developments in that area. It would involve a change in the whole sort of basis of clinical psychology employment post-qualification, I think, so it's quite difficult to achieve that. But, never say never.
James?
Yeah, I was just going to add in again about the CAPS roles. The expectation is that if you've been trained in that organisation, you remain there for 2 years after qualifying. So there's like a 2-year moratorium that I think all of the CAPS courses have agreed to and signed up to. So.
I think it's other recruit to train roles as well. Other roles. So I think there's a similar approach taken with mental health wellbeing practitioner roles, CBT therapist roles, essentially any roles that we know we have been able to secure system level or employer level funding. There's an expectation that the post holder will be tied into a 2-year contract post qualification.
And we need to make the jobs really attractive and the
Yes.
sort of place where people want to stay and work.
Yeah, let's not nail their feet to the floor and make them really unhappy for 2 years.
Yeah.
And I think that's the point, isn't it? It's about it's the picture. It's looking at the round. And I think, you know, as system level workers, supporting your local systems to actually understand that is key, and working together in this way is key. You know, Luke's representing the University of Birmingham. Maria's elsewhere leader a training programme. We've got Lawrence in the background, BPS. We've got people here that are working together systemically to actually try and improve our workforce. But on that note, Helen,
I'm going to run.
You've got to run. You've got plenty of time to be able to get there. Thank you very much, and hope to see you later. Thanks, Helen.